had this idea to do this fun vlog that would kind of show people like my town and how nice it was, and you know, Huntington gets kind of a bad rap. Unfortunately, it has rained all week. It will continue to rain all next week. That's fine. So I figured since it was horrifically raining and has been all week and will continue to be all next week, I figured since I couldn't show you around my town, I'd show you around the place I work. So I'm a veterinary technician. I'm a surgical nurse basically for animals. And so this is my treatment room in my animal hospital. We're one of the, I would say, busiest practices in our region. We have about 55,000 patients that we see. There's only 40,000 people in the town in which we are located, so that's pretty good. So like I said, this is our treatment room. We have the area where we do all of our dental cleanings, and we also do our sterilization and stuff over here, which is what all this mess is. Because of the pandemic, we are washing, reusing, re-sterilizing our surgical gloves. We actually got some guidelines from Johns Hopkins Human Medicine to help us be able to reuse those gloves and not take away from the human healthcare professionals that need them. These two machines here are our autoclaves. We have them in-house, so we do all of our sterilization in-house. This is a patient warmer. It connects to this little fancy blanket that helps keep all of our patients under anesthesia nice and toasty. We've got a couple of these in any areas where there are anesthesia things happening. This here is my home away from home. These are my babies, my blood machines. That's me in the reflection. Hey, what's up? We probably have the largest lab in the region. Our rep is always very, very excited to come and see us because we have so many machines. They're all connected to this ancient computer that has been here longer than I have been here, and I've worked here for 15 years. So somehow or another, this elderly machines manages to power all of these blood machines for me, which is a miracle in and of itself. We also do therapy lasers, cold laser therapy, and what it does is it really helps us, especially post-surgical, patients that have really bad arthritis, anything like that. It helps decrease inflammation and speed up healing, helps bring energy to the cells, and just kind of gets things moving where they should be. This is my surgical suite. We do a pretty good job, I think, of maintaining its cleanliness. It's not set up right now for surgeries. We've knocked it down for the end of the day. So everything you see in here has been cleaned and sterilized and has been set up. I come in further, but we're not really supposed to be in here if we're not doing surgery to help keep it contaminant free. This here is our anesthesia machine. You can kind of see it. It's what helps deliver anesthesia to our patients. We do cats, dogs, ferrets, rabbits, pigs, pocket pets, all sorts of stuff. Anything that if it has fur, and sometimes if it swims, sometimes if it flies, we'll usually see it. We have two of these. These are patient monitors. So I've got this set of drawers here to kind of help maintain some of the cables. But we actually have these in both our dental area and in our surgery room. They monitor all sorts of patient vitals, same as if you or I were to have surgery. We'll check heart rate, EKG, oxygen saturation, make sure blood pressure stays okay, temperature, make sure respirations and everything stays great. And there's a technician or a surgical nurse with your pet at all times in our hospital. This is our intensive care unit. We try to keep our patients that are sick or hospitalized somewhere where it's a little bit quieter. This side of the hospital tends to be pretty chill. We like to give them a nice, relaxing area to stay while they're here in the hospital, to make sure that they can stay nice and calm, decreases anxiety, and speeds up their healing. We also have ultrasound technology, so we do abdominal ultrasounds, echocardiograms, all sorts of stuff. Pay no attention to the giant box in the back. It's a huge pain in my butt, and we're trying to figure out what to do with it. We We also have digital x-ray, so it takes a really nice, crisp, clear picture. The black things you see here are patient positioners to make sure we get the best picture so we don't have to radiate the patients too much. We also have all of our nice PPE, a little bit of Febreze just in case somebody has an accident, and some disinfectant so that we can clean between each patient. We also have an isolation ward for anything that may be contagious. It stays completely separated from our general population. That way we can treat them without having to worry about cross-contamination. We have 6 exam rooms. Everything's shut down for the evening, so it's kind of dark in here. But we have a nice area for everybody to hang out in. We've got some space. This right here is because of the pandemic. We of course have our sterilization section so that we can get out the door without having to worry about whether or not we've got our PPE on correctly. Lots of food storage, of course. And here's the rest of those exam rooms. We've got lots of space for them. Again, they're knocked down for the evening, but plenty of room for people, pets, doctors, technicians. When we have the lobby open, we usually have about anywhere from 4 to 7 people in one of these rooms, so it can get tight kind of quickly, but we do a pretty good job, I think, of maintaining the flow. And this is what our clients see when they walk in the door. Nice, big, wide waiting room, plenty of room. We split up between cats and dogs so that we don't get too much stress happening, because that's how you keep your patients happy, is to keep them stress-free. Also, we're doing a giveaway, so that's why there is a huge grill in the middle of our lobby. It'll be gone eventually. This is our little grooming area. Of course, we have laundry machines. The floor where I just bathed Link. Look at this. Nice clean dog. Nice big bathtub. Industrial tub. And of course, industrial blow dryer. Best thing about working where the groomer works is that you can use the equipment to bathe your own dog. Hi, Link. He likes to play back. Look how handsome. All shiny. Link. Oh. It's very handsome. We also do some boarding, especially medical boarding, special needs patients, that sort of thing. Normally these runs are full of nice comfy bedding to help keep our pets nice and comfortable, but we're not doing any boarding right now because of the pandemic. And that's basically it. That's pretty much my whole clinic, and as it turns out, just as I've left, the sun's come out. Finally.